Good morning, everyone. Myself, Dr. Navya, and today I'll be reporting a case of a rare tumor of conjunctiva. That's the conjunctival malignant melanoma. So, conjunctival melanoma is a malignant tumor arising from the melanocytes of the ocular surface. It accounts for 2% of all the eye tumors, 5% of melanomas of ocular region, and 0.25% of the melanomas overall. So the precursor lesions like primary acquired melanosis and conjunctival nevi are the risk factors for developing melanoma. Because of its potential lethal neoplasm, it has like a 10-year mortality rate of almost 30%. So coming to my case, it was a 45-year-old female presenting with the complaints of brownish black pigmented lesion in the conjunctiva since childhood, which has increased in size from past 1 year. She had no other visual complaints, no systemic complaints like weight loss, cough, or fatigability, and no other similar complaints in the family. On examination, vitally she was stable. There was no lymphadenopathy. On systemic examination, no respiratory symptoms or no organomegaly. On ocular examination, the patient had a vision in the left eye of 612 improving to 6.9. There's a brownish black lesion involving the bulbar palpebral conjunctiva, including the lower fornix. You can also see the feeder vessel on the temporal side. The extraocular movements were full in range and painless, and fundus was within normal limits. We went ahead with wide local excision of the lesion with no-touch technique with amniotic membrane transfer, and cryotherapy with double freeze slow thaw mode is delivered to the margins. And the specimen sent to histopathology reported a nuclear pleomorphism and oval-shaped nuclei with increased NC ratio, a good number of tumor cells with melanin pigment deposition. And these features suggested of conjunctival malignant melanoma of epithelioid variant, but all the margins were clear of tumor. FDG PET CTs showed no metabolically active lesion in the left orbit, neither in whole of the body. And post-operative on follow-up visit, she was started on topical chemotherapy with mitomycin C, 6 cycles, and the patient is kept on regular follow-up to rule out see for any recurrences or metastasis. Coming to discussion, conjunctival melanoma is a rare but has a high mortality rate. Rapidly growing melanocytic lesions in the conjunctiva should be closely examined to rule out malignant melanoma. Systemic evaluation is a must to look for nodal and extranodal sites of involvement. And metastasis and recurrences are very common in melanoma, necessitating the long-term follow-up care. These are my references, and thank you.
Frequently you are calling the patient?
Ma'am, like when initially we started, we called her like every 2 months. And the CT we are doing, like PET CT, we are doing it every 6 months, like to look for metastasis. Right now she's on 4 months follow-up.
Okay. Would you show me the clinical picture once?
Yeah.
So how widely you had to excise the conjunctival part?
Ma'am, almost like 4 mm margin we left. Since clinically it was almost like a malignant feature. 4 mm margin in both the medial, lower fornix and the lateral side as well.
And on that side, upper bulbar conjunctiva also there is some part
yeah.
involved. What is that?
It was actually the one which is extended to the cornea was a pterygium, not exactly the melanoma.
Okay. But it's pigmented, no?
Pigmented.
Brownish pigment we don't get in pterygium.
Yeah, we had excised that as well.
So what was that on his HP?
It was malignant tumor only, but the corneal part was not the malignant.
So it has actually gone to that part also.
Yes, ma'am.
Okay. Thank you so much.
Yeah, thank you. I'll repeat. No, not an issue.
Sorry.
No problem, sir.
I'm sorry.
I told you. मेरे कागज 2 मिनट में आ.
अच्छा मेरी रिवीजन हो जाएगी प्लीज.
कोई बात नहीं.
Sir, only one person is the last second.
Navya.
Okay.
First slide.
Navya. Okay. I don't know that I could have waited.
No. Should I start the timer again? So
don't worry about the timing.
Yeah, can I just, okay. So today I'll be presenting about a case report of a rare tumor of conjunctiva, the conjunctival malignant melanoma. So conjunctival malignant melanoma is a tumor arising from the melanocytes of ocular surface. It accounts for 2% of the all tumors, all eye tumors, 5% of melanomas, and 0.25% of the melanomas overall. So the precursor lesions like primary acquired melanosis and nevi are the risk factors for conjunctival melanoma. It's a potential lethal neoplasm with 10-year mortality rate of 30%. Coming to my case, it was a 45-year-old female patient presenting with the complaints of brownish-black pigmented lesion of the conjunctiva, present since childhood, but has increased in size since 1 year. She had no other ocular complaints, no systemic complaints of weight loss or fatigability or cough, and no similar complaints in the family. On examination, she is vitally stable, no lymphadenopathy noted. On systemic examination, nothing significant, no organomegaly or any respiratory symptoms. On ocular examination, she had a left eye vision of 612 improving to 69. A brownish black raised lesion involving the bulbar, conjunctiva, palpebral, and the lower fornix was noted with a feeder vessel. Then extraocular movements were full in range and fundus was within normal limits. Management, we went ahead with wide local excision with no touch technique with wet amniotic membrane transfer, and cryotherapy of double freeze slow thaw mode is delivered to the margins. On histopath examination, the tumor cells were noted with increased NC ratio, nuclear pleomorphism. And the tumor cells also showed melanin pigment deposition and suggestive of conjunctival malignant melanoma of epithelioid variant, but margins were clear of tumor. The FTG PET CT showed no active lesions in the left orbit, neither the whole body survey. The post-operative patient was started on adjuvant topical chemotherapy with mitomycin C with 6 cycles, and patient is kept on regular follow-ups, and as of now, no recurrence noted. So on discussion, melanoma is a rare but a case with a high mortality rate. So rapidly growing melanocytic lesions in conjunctiva should be closely examined to rule out the malignant melanoma. Systemic evaluation is a must to look for nodal and extranodal sites, and metastasis and recurrence is very common, so patient has to be kept on long-term follow-up care. These are my references. Thank you.
Did you do an incisional biopsy before taking or straight
And
away
we
incision?
went ahead. It looked more like a malignant tumor, sir, the presentation.
Generally, where do you practice?
Sir, Regional Institute of Ophthalmology, Bangalore.
Bangalore.
Yeah.
Generally, because with these type of lesions which are very high on metastasis, could be fatal, and it's always nice to have an incisional biopsy.
No.
Because you also have to be prepared about what extent you need to go. And if you are dealing with something which is malignant, you have to do
Extra
more of excisions,
incision,
destroying the structures, important structures around. So for that, you have to be really 100% sure. Should not be based on the clinical especially when you have such a easily takeable lesion. And then the patient and the attendants are also much more convinced to have a larger surgery. So they get time to adapt to these type of shocks, which is like having something in the eye and having a malignancy in the eye. Okay, what all other chemotherapeutic drugs can be used for these type of lesions post-op?
We have used
Mitomycin. Was there any study which has used mitomycin over this?
sorry, sir.
Was there any study which is used?
Like there are a lot of studies actually which say that mitomycin might prevent the recurrence, and it acts as adjuvant therapy. Even if the tumor margins are not clear, sometimes where you can't do extensive clearance, mitomycin will help in
What concentration of mitomycin you used? You didn't use.
Were you present during surgery?
sorry.
Were you there during surgery?
I was not there. No.
Anyways, that was a very submission is good that you have clearly said no to it rather than beating about the bush. Thank you.